Numbness that comes and goes is a red flag. Let's explore this and see why. Your nervous system is your controlling system. So it's very, very important to make sure your nervous system is in top shape and is not irritated. With numbness that comes and goes, your nervous system basically, they go into hyper mode, hypersensitive mode. They don't like inconsistency. So when the numbness comes and then it goes away and then comes back again, we want to look at what environment are we having that makes this numbness come, and then what happens when it goes away. It is an indication of something big about to happen. It's just not happened full blown yet. So depending on the location of this numbness, we want to, this is the one thing you guys understand, that this is the one thing that you should not take it lightly and think you're going to solve with some stretching or some strengthening. You want to make sure you rule out any pathology first. We want to think about the worst case scenario first. We want to understand and make sure there is no pathology. And when there is no pathology, now let's explore what needs to happen. Most often, from my perspective, after I have ruled out pathology, I find out that the nerves, there are specific nerves that are being irritated, and they're highly depending on movement and positioning of the body. They're highly depending on the individual's activity. So we want to look and see what's going on, and what I see is dysfunctional patterns of movement that are taking place. So this individual goes from point A to B, but what takes that person from point A to B is not the right right body part. It's a full-on compensation, full-on dysfunctional patterns of movement. So how do I go about fixing that? I always think of stability as number one priority. And that always starts with breathing, biological breathing. Biological breathing is what I'll put at the end of this video. If you have not subscribed to the channel, make sure you do. But that, oh my gosh, it comes with so much wisdom buried with the breath. There's a specific way of breathing, and this is, by the way, inspired by watching human babies. When you breathe that way, there are so many valuable things that are taking place. The compression, the irritation on your body part is removed. Your internal organs are able to oscillate up and down between your abdominal and pelvic diaphragm, which means your internal organs are not compressed, because your body parts do not like to be compressed. They can withstand it, but they don't like it. And if it becomes too long of compression, they're going to speak up. So when it comes to numbness coming and going, I'm thinking a nerve is being irritated. I'm thinking we need to rescue this thing. So that does not mean I go stretch it. That means I'm going to look for instability. And I am using in my practice the same things, the same exercises I give my patients are sometimes the same tools I evaluate to see where the instability is. I use developmental exercises, the same steps you took as a newborn to become a running toddler, to establish the stability. And most importantly, that's an opportunity for my patient or client and myself to understand what right looks like, what stability feels like. Not the end result, but the path to get there is the key. Once you as a client or patient understand what that path looks like, what it feels like, you police it yourself for the rest of your life, because that's how it should have been all along. I hope that this helped you understand that nothing in your body happens randomly, and we have to understand the why behind the action. Thank you so much for watching, and until next time, take care.